Over the years, prevalence rate of HIV/AIDS in Karamoja sub-region has been relatively low. This status quo has been changing due to several reasons, among them ignorancy, illiteracy, and exposure of the region to development.
And we know that business influence the movement of people from one area to another. And as people move, they move with infections. As people move, they move with their practices, and they tend to change the practice of the area.
According to Dr. Anthony Okenge of Moroto Referral Hospital, there is also a case of many young population migrating to other regions of the country where some are exposed to the infection and return home when they are sick.
They reach home because of the ignorance among the people. They tend to spread the infection.
Studies have shown that the prevalence rate in the urban areas are high, but are also growing in rural areas.
Fortunately, the prevalence of HIV is higher in the urban settings. But in Karamoja, it appears the prevalence is high in the rural setting.
Titus Twesige, the country director of the Alliance of Mayors Initiative for Community Action on AIDS at the local level in Uganda, explains that the knowledge about HIV/AIDS is still low in Karamoja.
The factor of stigma, because in Karamoja, they still strongly stigmatize people who are living with HIV. They think the HIV can be transmitted through casual contact and the rest.
Socio-cultural practices like widow inheritance in Karamoja also has a role in the spread of HIV.
The traditional and the cultural practices that are in Karamoja, the spread of the epidemic can be so fast.
Sam Isiko, a task coordinator in the region, says people with HIV have trouble accessing health centers for treatment.
Go to the ground, you find that people still lack the accurate information about HIV transmission, prevention, and generally even what to do.
One of the traditional leaders, Filipo Chomola, says poverty has also contributed to the spread of HIV in the rural settings.
People are sleeping, a person can sleep even a week without something to eat. So that person, if he knows he's a girl, she uses what to do instead. They say like this, all are deaths.
The use of alcohol is another factor that leads to the increasing rates of infection.
But now water goes up there. Who takes water? Traders.
Some of the villages we visited show that the consumption of alcohol here is a leisure pastime. Akumala, however, had no kind words for non-government organizations. He says spend a lot of time in workshops in town, pretending they are working hard to find solution to the problems in Karamoja.
Gathering inside of the houses like that or in a sub-county. That one people cannot take the message.
This was the main reason Amical and the AIDS support organization TASO, with support from the Irish Aid, were in Karamoja region to forge a way forward on how to overcome the new threat of HIV in Karamoja. AIDS report for 2010 indicated that HIV prevalence were lowest in Karamoja region at about 2 and 3%. Reports say this currently stands at 5.3%. Ivan Chimulichigozi, NTV.